Hello everyone. So this is Dr. Avinash Jain, an orthopedic spine surgeon from Indore. Let us discuss the most common topic today, or in fact I would say let us guide you how to prevent from back pain, and that to lower back pain. So there are so many reasons why a person in his middle age group or elderly age group or even the younger age group develops back pain. Most common reasons of back pain are it's because of the poor posture, unhealthy lifestyle, prolonged sitting, weightlifting in poor posture, driving in an abnormal positions, prolonged driving. So these are the some of the basic problems in a young patient. When the age increases, our bone get weak. The bones which are healthier in your younger age group may get deteriorated, degenerated in elderly age group. So as you grow elder, you should be very precautious towards your spinal health, and that is your spinal alignment and movements. So I would say instead of going for reasons, we should discuss how to prevent back pain. So there are more and more people who are into IT sectors now, who are computer professionals, who have a prolonged sitting habit in her or his office, banking job, professionals, medical professionals. So everywhere you will see people are sitting in their chairs for more than 6 to 8 hours in a single stretch. So this is absolutely wrong. I would say smoking से जो प्रॉब्लम्स होती थी वो अब सिटिंग से होती हैं. So sitting is a new smoking. Now if you sit for more than 2 hours in a single stretch, eventually your disc, which is an intervertebral disc, is a soft gelatinous material which is inside the vertebral body. It's a soft gelatinous material which is in between your two vertebral bodies and just anterior to your spinal nerves. So this material, this disc is basically meant to absorb your shock. So shock can be generated when you go for gymming, when you do aggressive sports, when you do for long hours driving, and even when you sit for a longer duration. So these structures get compressed, and if you lie down they get decompressed. So this is an elastic structure which has a lot of water content in it. So to continue its healthy structure, to maintain its health, disc health, you need to drink a lot of waters. Everyday exercise. Don't go for aggressive sports, don't go for prolonged sitting, and don't go for unobserved gymming. So we have seen frequently now youngsters at the age of 19 years, 20 years, 23 years, once they have moved from their college to from their school to colleges, they start and hitting to the gym under the supervision of an untrained professional, and they start taking out weights, say 50 kg, 100 kg unattended, under the supervision of an untrained professional. So this is absolutely wrong. Such type of abnormal and poor posture weightlifting leads to increased pressure in this disc, and these discs may get herniated. So it is always recommended. Everyone loves gymming, everybody loves sports, but you have to be supervised either by a physiotherapist or a trained professional. Secondly, so second most common questions which most of you guys ask, how they ask how to prevent constant backache. So for constant backache, first of all, if your backache is persisting more than 3 to 6 months, you need to visit some of the spine specialists, right? Secondly, you have to figure out what is the main reason. Either you are going for a prolonged sitting, or you are going for an abnormal gymming, or the conditions which I have mentioned. Secondly, if your spine specialist says that you have to undergo investigations, you should get it done at the earliest, because if you prolong your painful condition, there happens certain permanent changes in your spine, and which are difficult to treat. Now the next questions which most of you ask Does every back pain leads to spine surgery? So since I am a surgeon, I would like to mention you only 5 to 10% of all backache percent, or less than 5% even I would say, eventually goes for spine surgery. So 95% back pains are preventable. The safety of spine surgery has increased from 80% to 95 to 99% nowadays. So don't fear of spine surgeries. So you have to drink a lot of water on a daily basis, at least 4 to 5 liters of water per day. Fourth point, you have to maintain your diet healthy. A lot of fibers, a lot of protein, and less carb. If you maintain all those things, your spine is going to be a healthier spine throughout your life, and you may not be suffering from any low back pain. The only thing, the last message I would say is, don't bend forward and lift weight. Don't bend forward and do the job. Don't bend forward and drive. Forward bending increases the disc presses and it leads to injury of the disc. So maintaining the posture is the primary important thing to prevent yourself from back pain. Thank you everyone.